So next month, the Iowa Rural Development will host their annual Rural Summit online this year. And just want to remind everybody that that summit, the registration is open now at iowardc.org/summit. And as we look to the future, we continue to focus on sharpening the competitive edge of Iowa's small towns while assuring that their baseline needs are being met. Empower Rural Iowa remains a work in progress, and as the task force addresses and prioritizes needs and emerging ideas for the next legislative session, reliable EMS services is an issue that needs addressed. So, as we head into this coming year, I will be establishing a new task force that is protecting rural EMS with the goal of recruiting and training new EMS volunteers as well as supporting just rural EMS in general. So with this new task force, we're going to be looking for ideas and people with a passion for improving rural EMS services and access to join the team, and you can do that by logging into www.talentbank.iowa.gov. So, as the Lieutenant Governor and I hit the road to continue our 99 county tours, we've been very lucky and fortunate to see the Empower Rural Iowa initiative in action. And I just want to say, Adam is a true champion for small town Iowa, and as the co-chair of the Governor's Empower Rural Iowa initiative, and I know that he can't wait any longer to tell you all about the rural innovation grants that we're going to be announcing today. So with that, Lieutenant Governor.
Well, thank you, Governor, and good morning. Thank you, Kathy, for hosting us here today. And I also want to take a moment to say thank you to Governor Reynolds for making rural Iowa a priority for our administration and for tasking me with co-chairing the Governor's Empower Rural Iowa initiative. I also want to take a brief moment to say thank you to Sandy Ehrig, who's the co-chair of the initiative. She's not able to be here today. And, of course, Liesl Siebert, who the Governor recognized, who is the director of the Center for Rural Revitalization and also effectively functions as the executive director of the Empower Rural Iowa task forces. And we definitely couldn't do this without Liesl's efforts and Sandy's leadership as well. The Rural Innovation Grant Program was a concept that was created to support creative, non-traditional ideas that focus on current issues facing rural communities. It's administered by the Center for Rural Revitalization, and these grants are a great example of the resources that are available through the center. Requests can range from $1,000 to $20,000 and must focus on investing, connecting, or growing rural Iowa. There's a local match requirement, and projects must exist and benefit a community with a population of 20,000 people or less and not adjacent to a city with a population of 40,000 or more. And the application must describe how the project could be a replicable model across rural Iowa. All applications are reviewed by a panel which includes Empower Rural Iowa Task Force members who the Governor has chosen from all across the state, IEDA staff, and expert professionals in the field. The inaugural round of Rural Innovation Grants had a great response this year with 22 applicants, and we're very happy to announce today that we're able to fund 17 of those projects. With the $300,000 that's been appropriated to this, we're able to leverage $1.8 million in project investment. The grants that are being announced today are small-scale local projects which aim to have a big impact on their communities. For example, the grants support communities which are doing placemaking projects like Stanton, Lenox, and Sheraton, where they're doing downtown improvements and renovations. Or the Starmont School District in Northeast Iowa, where students will create augmented reality-based artwork to highlight local community attractions. The grants also support efforts to solve real problems in rural communities, providing a rural grocery delivery system for communities that don't have a grocery store, and connecting rural downtowns with Wi-Fi, providing better access for businesses and low-income residents. And the grants support the efforts of entrepreneurs in places like Pocahontas, Monticello, Atlantic, and Jefferson, and right here in Webster City. Within these walls, doors are opening to welcome diverse cultures that enrich this community. This kitchen will be doing so much more than simply feeding people. It's starting conversations, sharing ideas, and building businesses by empowering entrepreneurs. So, Kathy, we're very honored to present you this grant award and can't wait to hear more about All Cultures Equal story. So that, Kathy.
Thank you. Gosh, when he explained our kitchen, I should have written that down because that was really good. Here at All Cultures Equal, We work to build trust in our community through providing cultural activities and events and classes. We teach English and Spanish. We have international cooking classes. We have a food pantry. We're pretty busy. We know that people connect over food. Food is a hospitality basic in every culture that we have. And we found that here, that when we have food, more people come, more people talk. We've been doing some of that before. We have international cooking classes. We have a language lunch where people come and learn how to speak English and Spanish. But the big dream here has been to have a community shared use kitchen. This kitchen started with a grant in March of 2019 and is finishing up with the Rural Innovation Grant, which will provide all the equipment that we need. A commercial shared use kitchen is a licensed kitchen, so the health inspector comes, the building inspector comes, the fire marshal comes, and it has all the equipment that someone needs to provide food as a business. So we already have about 7 people interested. We have a Laotian cook, we have a Thai cook, we have a Mexican baker, we have a lady who wants to make Mexican breakfasts, we have someone interested in brunch. And what will happen is that they will come here and use our facility to make their food. If you want to be a restaurateur, you have the licenses, the building, the furniture, the insurance, all the utilities, and it costs a lot of money. So here, their only costs will be to rent the kitchen. They have a restaurant license. They have a free sales tax permit. They will have liability insurance, which is very low. And then they will take a serve-safe food preparation and safety class. This grant will allow us to do that training for the first 10 people who rent and for our staff here as well. Of course, I'm not using my notes. The advantage of having a community shared use kitchen is that anybody can become a restaurant. And especially now during COVID, it will be all takeout restaurant. But they can come in, we have the facility, we take care of the electricity and the mechanics and all that kind of thing. And they come in, they prepare their food, and they can sell it right away. So they can legally make meals, they can legally sell jams, they can become a bakery or a caterer. So many people who don't have the money to start a big restaurant or even a little restaurant can come here with a very low investment to start and can try out their restaurant. We have partnered with the Small Business Administration, and they will be helping everybody make a business plan for their restaurant business, as well as help them with marketing. So that will be a real big help for them. Also, lost that train of thought. Oh, also work as an incubator for businesses. So people can come here and try it. They can change their menu. They can try different foods, different preparations, and they can see what works best in this community. The community is really excited about this because we already have a wide diversity in our community, and we have lots of people who want to try different foods. So I have people every day say to me, is that kitchen done yet? Don't you have that kitchen done yet? And hopefully by September 1st, we'll have that kitchen done. So I'm hoping that a lot of people will take advantage of this. But this is the culmination of a big dream that ACE has had for a long time. And we want to thank the governor and lieutenant governor for providing these extra funds for us to finish. Thanks.
Nice job. See, she was nervous. You did great. No reason to be nervous whatsoever, and you truly are making a difference here, Kathy, so thank you. And really, congratulations. What a great model for other communities to take a look at, and that's really what, a big piece of Empower Rural Iowa. If you can do it, then we can do it, maybe with a different take or whatever. So thank you for that. So I think what I'll do right now is I will pause and see if there are any questions on topic, and then after we get done with that, I'll do a little bit of a COVID update, and we'll take questions on anything. So if anybody has any questions for Kathy, or Adam, or anybody here, this is your opportunity.
How much is your grant at K-Land?
Yeah, I know. I was kind of wondering too, honestly.
Our grant is for $9,400, and that will provide for the commercial cooler and new pots and pans and mixers and a new stove. So it'll polish out what we're doing.
Abby, would you be able to spell your name for us? So we can sort of,
Sure. V as in Victor. Aughn.
and is it Kathy with a K? Or?
Kathy with a K.
I-E or Y?
Y.
I want those questions.
As long as you don't ask my age,
Yeah.
I can tell you anything.
Can you explain, you said you have a lot of interests, right? So who coordinates, is it an arm wrestling tournament? How do you decide who gets the kitchen at what time? That seems complicated.
That will be my job. We haven't ironed all that out yet. It depends. Some people will want to use it just once a month to try new things. Some people have already talked to us about doing it. Like the lady who wants to do Mexican breakfast, she wants to do it Monday through Friday from 6 to noon. Most people will want afternoons and evenings, so we'll just have to balance those out. Yeah, I hope that's a problem.
What's the capacity? How many can you take to start out with? Did you say that? I can't remember.
I'm thinking probably 10. With the people that I know now interested, I think we can handle all 10. And then we have the funds with this to have them train in the Serve Safe program so that they will know all about food safety. That was easy.
Different variety of food we do in here. Mexican, Laotian.
Right, we'll have Mexican, Laotian, Thai. I have a.
German.
Oh, yeah. We also teach international cooking classes. So we've had classes for Laotian food, for German food, for Norwegian food. Yeah, we had lutefisk. Not very many people tried it, though. We have a lady who wants to do Jamaican. We have someone who wants to do Southern cooking for international classes. So those are really fun. It's just a group of about 6 to 8 people, and we make food and then we eat it.
Okay. Thank you so much. I really appreciate that. Sounds like you have a lot of fun here, and who doesn't like to eat their way through fun, right? So that's awesome. So, in closing, I want to provide a brief update on Iowa's COVID-19 status. We continue to closely monitor Iowa's numbers regarding positive cases and the impact that it has on Iowa's most vulnerable, on our most vulnerable Iowans, our healthcare system, the number of vents and ICU beds that are being utilized and those that remain available. We continue to monitor the impact on our state positivity rate, our days to double. The majority of the cases are still largely concentrated in 10 counties and among younger adults. We are testing significantly more now than we were 2 to 3 months ago. And in fact, I think as you know, last week we actually surpassed 100,000 tests conducted at Test Iowa sites alone since April 25th, and that's when the first Test Iowa site opened. And in total, more than 380,000 Iowans have now been tested, with a per capita test rate of 1 in 8 Iowans have been tested. As the numbers continue, as the number of Iowans tested continues to increase, we will see higher numbers of positive cases. But the positivity rate is an important part of the story, and so so is the number of total negative cases. I want Iowans to be assured that we are monitoring the situation daily. We know where the highest positive cases are occurring and why, and we're carefully considering whether additional targeted mitigation efforts are necessary to slow the spread in some areas. But it's important that Iowans remember that each of us has the ability to slow and contain virus activity through our own actions, whether that's wearing a mask, social distancing, practicing good hygiene, or staying home when you're sick. And I think we all know, as we've said from the very beginning of COVID-19, these are simple steps, and they continue to be our best defense against the virus. COVID-19 is far from over, and we need to continue to step up and take personal responsibility, and not because it's mandated, but because it's the right thing to do. That's how we'll keep Iowans safe and healthy, keep our economy up and running, and keep our state moving forward. One of the most important milestones in our recovery effort is getting Iowa students back to school. Within the next several weeks, schools will begin reopening, and while the school year will be different than it's ever been before, it is critical that we prioritize bringing Iowa's children back to the classroom, but of course we do it in a safe and responsible manner. Iowa schools have submitted their return to learn plans, which includes options for in-person learning, virtual learning, and then of course a hybrid models for both approaches. Parents, teachers, pediatricians, and other experts across Iowa and the nation are all weighing in on this topic, and we intend to engage them in this very important conversation. In the days to come, I'll be sharing more information about Iowa's plan to return to learn, and we'll be doing that in the coming weeks. And I think I'll probably be holding an additional press conference yet this week. I think we're tentatively looking at Thursday, but we'll be sure and let everybody know. But we are going to hold another press conference this week just to continue to update Iowans on what's taking place. So with that, we will go ahead and open it up for questions.
Why did Iowa not submit data to a CDC study about meatpacking plants and COVID-19, and when do you plan to release data about COVID-19 in Iowa's meatpacking plants?
Well, we've been very transparent and upfront about the data. I would refer that question to the Department of Public Health, and especially Dr. Ann Garvey, and I'm sure she'll be more than happy to respond to that question. But we've been very transparent about the testing. We've led the country in what we've done with testing in our processing and manufacturing plants, not only with PCR or diagnostic testing, but we even went above and beyond that with serology testing so we could test for antibodies. We made the testing available. We were able to get Abbott test kits at the beginning so we could do some rapid testing to understand positive and negatives, separate the shifts, make sure that they had the PPE, and was able to get the plants up and going in a safe and responsible manner so that we could keep the food supply chain moving, which was critically important. I want to thank our farmers. I want to thank our truck drivers. I want to thank our processing plants and our grocery stores for helping feed not only Iowa but the country and the world. And it was imperative that we continued to keep that supply chain moving. So if you have additional questions with that, I would direct you to the Department of Public Health and specifically Dr. Ann Garvey.
Governor, the state auditor today released a report detailing the chain through which the information, test results from Test Iowa get sent first to the private companies that are responsible for Test Iowa, then the Office of the Chief Information Officer, and then the Department of Public Health. He said this practice is illegal and is potentially infusing more risk into the process. Why does the data not go directly to the Department of Public Health?
Well, I would refer you to the Attorney General Miller's office. He has concluded that the state hygienic lab procedures do follow the law, and they have an extensive letter that they have put together that addresses the state auditor's issues. And so I agree with Attorney General Miller's office in their report that the state hygienic lab is following the rule of law. And I want to just tell Iowans that my focus over the last 4 months in this unprecedented pandemic that we face not only in Iowa but across the country has been to protect the health and safety of all Iowans, to make sure that we were doing everything we could to not overwhelm our health care healthcare system, to flatten the curve so that we could start to recover and open up our economy and get Iowans' lives and livelihoods and our children back to normal. And we've been able to do that by significantly increasing our testing capacity. And we've been able to do that because of Test Iowa. You heard in my remarks earlier that over 100,000 Iowans have been able to be tested through Test Iowa. I continue to show the map, but not only are we doing the drive-ups, but we're working with local clinics across the state of Iowa to make sure that we can provide testing to rural Iowa as well as some of our larger cities. And that is how we're going to be able to, with significant testing, with the state hygienic lab, and with the contact tracing, continue to work with Iowans and businesses and continue to move this state forward. So lastly, I want to give a shout out to the individuals who are working at the state hygienic lab and our Department of Public Health. State workers that have done yeoman's work over the last 4 weeks, for months, many of them working 7 days a week to not only make sure that they were doing everything they could to protect the health and well-being of Iowans. And they deserve a shout-out. They are our heroes who have diligently been working every day to help us move forward, to help us stabilize, recover, and come back stronger than ever. So I'm proud of the work that they've done. I am proud to have Test Iowa be a part of this process, and we continue to build capacity and continue to offer opportunities to Iowans so that they can know if they are positive or negative or have the antibody with serology testing, which is another area that we are also doing quite well in. In fact, with serology testing, I think we've tested 1 in 89 Iowans, which is incredible. And our turnaround time puts other states to shame with the processes that they've been able to put in place. The national labs, it's still taking 5 to 7 days with the state hygienic lab for the most part, and we continue to get better all the time. It's 2 days, so I'm really proud of that.
Governor, you said you know why case counts increasing. Why?
Well, no, I said we know who. We know
You
that.
said why.
Okay, well, then I meant to say who. So what I was saying is that as we're testing more, we're seeing the positive case numbers go up. That's just a reality. And we know that it's still among younger adults. I think the average age this week when I sat down with Dr. Padati was age 21 to 22 was the average age of the test positives. We're seeing significant declines in our older populations and those that are most vulnerable, so they're doing what they're supposed to be doing. And, Kay, we are taking a look at it. I mean, there is some correlation. They're out. They've been pent up for several months as we start to open up the economy. I don't think it's unreasonable to think that we're going to see maybe a little bit of an uptick in positive cases. They were able to drill down with some of the data, and it does correlate somewhat with opening and expanding bars. So we know that's a part of the scenario. Protest or just people being outdoors and in close proximity, and not everybody wearing a mask. And so there's a lot. Those are some of the areas that I think Dr. Padati brought up as they could kind of tie to what potentially some of the increase in the younger individuals' positive cases.
What are those potential mitigation measures that you're looking at?
Well, several things. But the good news is we're still not seeing our over-positivity rate change much. So we're still bouncing around 9.3, 9.4, which is still really pretty good. Our days to double are 53. Our hospitalization has ticked up just a little bit, but it's kind of ebbed and flowed and stayed pretty consistent. Thank goodness we're seeing our death rates continue to decline and be minimal. That's a really positive outcome. So maybe we go back to 50% capacity in bars. I don't know. But the thing with the data that we have and the ability to drill down and really do that case investigation is it gives the epidemiologist, the team, the information they need to make those recommendations to me. So we're looking at different responses, and I think the most important thing is we can be very targeted in those responses. You will not see me shut down the entire state. We know where the increases are taking place. We have some idea of what we believe it may be tied to, and so we will target our response based on the information that the Department of Public Health and the epidemiologist team is collecting.
Two more questions.
Are you comfortable that once schools are putting their plans together, obviously some parents that have concerns about whether their children will be safe and whether they can bring anything back home. From the teacher side of things, are you comfortable that the districts will be able to have enough teachers who feel like they're healthy enough to be in a traditional classroom? As you know, they're surveying teachers now about who has pre-existing conditions,
Yeah.
would rather do remote or do somebody in your household who has. When that all breaks down, and then some other administrators have talked about the availability of subs when some of the teachers start going down and are quarantined for a couple weeks, whatever.
Yeah.
That whole complicated process, are you
Yeah.
comfortable that there will be enough healthy people to accomplish this?
Yeah, well, we've really faced that same scenario with our healthcare workers. We've faced it with daycare providers, with our daycare centers. Just a big chunk of Iowa's workforce that has stayed up and running throughout the pandemic. But Dave, we do know that that is an issue, and we're looking at that right now and seeing what we can do, because a lot of times our subs are elderly population, and we know that they're more vulnerable. So as school districts are being innovative, I believe that school districts and teachers know without hesitation that our kids need to be in the classroom. You know, we are doing them a disservice by not opening these schools back up and getting them to school. But we have to be flexible, we have to think outside of the box, and we have to look at different alternatives. And so, you know, giving parents the option with kids that have underlying conditions or someone in the household that does to go 100% online, that's a parent's choice, and we most certainly should offer that. But I think the goal should be to get everybody back to school. So we're going to work with the educators, we're going to work with the school districts, make sure that they've got the, you know, PPE, make sure that they have the flexibility, and workforce is a big component of that. So right now, we're looking at different options that we can help provide them with the workforce that they need to just be ready for whatever, you know, happens as we kind of move through the next stage of opening our schools back up. Kids are less likely to get it. They're less likely to spread. I mean, so I think there's some pretty good data out there that will help alleviate maybe some of the concerns. But we know also that data says if you're of a certain age group, an older population, and you have underlying conditions, you are the ones that are most impacted by COVID. And so we need to take that into account when we're putting the infrastructure in place.
What additional measures are you doing for the prison system, given the outbreak at the Fort Madison facility?
Yeah, so Beth has done a great job, and she had a lot of plans already in place before we ever entered into this, and it kind of was not a matter of if, but when. I mean, with the congregate setting like that, and you just have people that workforce that are in and out, that eventually, you know, they get exposed. So one thing that I wanted to be sure and let everybody know, if you go to the website, Beth and the warden and the doctor did a Q&A yesterday, and they filmed it, and there's a lot of good information there. So it's at doc.ia.gov/COVID-19. And so there's a lot of the questions will get answered there. But right now they've had 187 that have tested positive. There are no pending, 16 staff. They are retesting all inmates that tested negative today. So we have the testing capacity, again, to be able to address situations like this when they arise, and just to make sure that we're monitoring that. But, you know, they've got plans in place to isolate when a unit is testing positive. And Beth was on site. Director Skinner was on site yesterday. She has sent information out to all of the legislature and contacted a lot of the family members as well. And so they thought the best way to really get the information out to everybody was to do a Q&A and answer a lot of the questions that she was receiving from some of the phone calls. So they did that yesterday.
Thanks, everyone.
Thank you.